Delaware remains in the grips of an opioid epidemic that is ruining lives, shattering families, and wreaking havoc on our criminal justice system. Just last week, the U.S. Center for Disease Control revealed that of 22 reporting states, Delaware had the largest percentage increase in fentanyl-related overdose deaths in the country in 2016. Over the last 2 years, the state has taken some important steps to better combat this epidemic. Much stricter controls have been put in place on the prescription of opioids. Laws passed earlier this year with the help of several people in this room are going to help break down insurance and Medicaid barriers to getting people treatment. Thanks to the hard work of advocates like Don and Jean Keister, many first responders are now carrying naloxone, which can be used to resuscitate overdose victims. But much more needs to be done. Here at the Department of Justice, we've been vocal in advocating for these and other reforms because this epidemic is a human tragedy, a public health crisis, and a disaster for the criminal justice system. Late last year, with the help of David Mangler from the Office of Controlled Substances, who's here today, our office hired an independent consultant to assess the deficiencies in Delaware's treatment network for people with opioid use disorder, and we're releasing his independent report today. It's a very helpful tool in determining the real costs involved in getting the state where it needs to be. For one thing, it tells us how short we're falling. There are 11,000 people in Delaware who need treatment for an opioid use disorder. About 6,000 people are getting treatment. So we're treating just over half of the people who need treatment. And that number actually understates the problem because it doesn't reflect the scope or the quality of the treatment that's being provided. This independent report also provides us with some broad estimates of the cost of filling in some of those treatment gaps. And those cost estimates are incorporated into the recommendations that DOJ is making today. We have a summary here of the independent report's recommendations that we can give you, and the press release that we're handing out has a website where you can review the independent report in its entirety. That's one tool. The other important tool that we employ here at the Department of Justice is listening to people on the front lines, people who have personally struggled with substance abuse, families who have lost loved ones, medical providers who treat people suffering from substance abuse. Those who have dealt with the problem and with the system firsthand have invaluable knowledge that must inform our efforts to address the crisis. So from all this, from listening to experts, listening to people on the front lines, looking at what's going on around the country, we've developed a list here at DOJ of the steps that we think that the state should take immediately to build on the work that's been done over the last 2 years and more effectively attack this opioid epidemic. And those recommendations are in a written report that we've handed out to you, but I want to just give you some highlights. First, it is time for Delaware to spend money on this problem in a way that reflects the fact that the opioid epidemic is killing Delawareans at a record rate. It is our #1 cause of accidental death. Dealing with it should be a priority in our state's budget. For starters, Delaware must invest real dollars in expanding and improving its treatment programs for those addicted to opiates. The General Assembly passed legislation this year to give treatment facilities a better chance of receiving insurance funds and Medicaid funds to cover extended care for appropriate substance use disorder patients. But those insurance funds are of no use if there are not facilities for victims to receive that treatment. There are significant startup costs involved in setting up new treatment facilities, and the state needs to help with those startup costs. We recommend that the state invest $4 million in one-time economic development funds to incentivize new opioid abuse treatment facilities to set up shop in Delaware. Delaware has spent tens of millions of dollars of economic development funds on all sorts of initiatives over the last 2 decades, including the expansion and maintenance of healthcare facilities. Now it's time to use economic development funds to create jobs in an area where Delaware desperately needs them, opioid abuse treatment. On top of those one-time incentive funds, we also recommend that the state add $650,000 to its annual operating budget to improve the interaction between existing treatment programs, to ensure a warm handoff between emergency rooms and longer-term care programs, to make better use of the state's web resources and the state's 211 hotline, better handoffs from law enforcement personnel to treatment. These are not glamorous expenses, but the independent report identified this as an area that the state should prioritize. Similarly, the state should institutionalize funding for police agencies to carry naloxone. That's a drug that has to be regularly replenished, and right now it's being funded by temporary funding streams. That is a public health issue, and the state should take responsibility to fund local police agencies carrying naloxone. Not all of our recommendations involve spending money. We believe the state needs to better regulate medication-assisted treatment programs that use drugs such as methadone to help people with substance use disorder work their way out of addiction. Doctors, police, judges will be more inclined to take advantage of those programs if they have confidence that the state is ensuring that those programs are not just dispensing medication, but also providing the counseling and monitoring and follow-up that's a necessary complement. Additionally, we think the state needs to promptly start working its way through the legal and medical issues involved in requiring involuntary treatment for those persons with addictions for whom all other realistic options have failed. There are still issues on the opioid prescription front as well. Senator Hansen has wisely suggested that the state find a way to ensure that insurance coverage allows individuals who want to get pain treatment by means other than prescription opioids to be able to do so through their insurance plans. And Delaware still has a serious problem with co-prescription of opioids and benzodiazepines such as Xanax, something that is rarely appropriate but happens often in Delaware and carries with it substantial health risks. Both of these areas should be addressed in the near future. Finally, the state should turn its attention to two specific groups where specialized approaches carry real promise. Other states, including states surrounding Delaware, have seen the creation of recovery high schools, which specialize in the education and rehabilitation of high school-age students struggling with addiction. Delaware should take the steps necessary to create such a high school here. And Delaware should also begin taking wider advantage of the long-acting injectable drug naltrexone to assist individuals in the criminal justice system who are being released from prison or awaiting trial to help them stay away from opioids. The U.S. Substance Abuse and Mental Health Services Administration has found that naltrexone, unlike other medications involved in treating substance abuse, reduces opioid cravings, eliminates the high that's associated with opioid use, and because of those qualities and the fact that it's an injectable drug, does not present risks of diversion or abuse in prison settings. Individuals in the criminal justice system are particularly susceptible to opioid abuse when they regain easy access to opioids, and naltrexone can help stem those urges while longer-term treatment is sought for them. So I've just described these recommendations to you in very general terms, but you'll see in the document that we handed out that we have been quite specific in what should be done and who should do it and on what time frame. Most of those time frames are quite aggressive because people are dying and there needs to be a focus and urgency about our work. You will also see in the document we've handed out that most of the recommendations involve the Department of Justice assisting in working out the details of what should be done. We will continue, as we have over the last 2 years, to not just say what we think must be done, but also to roll up our sleeves and pitch in to do the hard work. So I want to step aside now and introduce Lieutenant Governor Bethany Hall Long. She has been busy already as the state's new Lieutenant Governor, and she championed legislation this year, which was sponsored by Representative Bentz, who I also saw come in, that set up a new Addiction Action Committee and Behavioral Health Consortium. You'll see if you look at the plan that we handed out that we expect this new Addiction Action Committee to play a critical role in implementing some of the recommendations right out of the gates. And over the long run, this Behavioral Health Consortium that she helped establish is going to be an important part of this effort, too, because not only are there substantial overlaps between substance abuse and behavioral health, but this consortium is going to set up the type of long-term oversight that's really necessary for an effort of this magnitude. We're trying a lot of things here at once because of the scope of the problem. That's the right thing to do, but those efforts are going to have to be monitored and adjusted over time, and these two committees that she has helped establish are going to be a critical part of that. So we're very grateful to her for helping to set them up, and I would like to welcome you to our office, Lieutenant Governor.
Thank you.
The floor is yours.
Thank you. Thank you so much, Attorney General Den. And as I look out and I see faces and families and stakeholders, I think I could fairly say that none of us want to be here today. And I think all of us are tired of talking at and about the opioid epidemic. Having said that, as I look around the room, I recognize that there is so much that we've done and need to continue to do both in prevention, interdiction, and treatment around the opioid and other epidemic. Because if you know, those of us who are in elected office, those of us who are families, those are volunteers, and our leader here today, Attorney General Den, our phones ring. I get a call, minimum of 2-3 calls a day from families affected by this all over the state, zip codes from Sussex to Greenville, and it affects everyone. And there is a story. And as our Attorney General indicated, it is a group initiative, and it's action that we absolutely need. And I commend you and thank you for your work, not only as the Attorney General, but as Lieutenant Governor and Insurance Commissioner, for recognizing how important access to service and care really is. And this report, as our Attorney General stated, is one of probably a series of many reports that we'll be using. I know Secretary Walker and Dr. Rattay and Representative Bentz and Senator Hansen, Senator Townsend have all been eagerly combing through a lot of various forms of data. And when you talk about data, the one thing I want to emphasize as a nurse that I think is the most important message that we carry away today as the press is that those statistics of 308 who passed away last year would have been much more if we hadn't passed several pieces of legislation around the Narcan. But that is a person. Those data are names, they're families, and they are lost dreams and lost contributions to Delaware's economic force. And as our Attorney General indicated, it's going to take all of us. And I know that through the efforts of Governor Carney's transition report, working with all of you to do the Behavioral Health Consortium, that's a long-term solution that will link both behavioral mental health and substance use and substance abuse disorders. Because let's face it, opioid and epidemics are the epidemic today. 10 years from now, it could be a different drug. You know, we had this gathering years ago when we had bath salts. You know, let us take this chance nationally and under the leadership of our Attorney General, our Secretary, our Governor, and our leaders in the legislature, as well as our leaders in the judicial system, the DOJ, and law enforcement coming together. So the data that are in the report that you shared with us really say it all. 500% increase in individuals getting opioid treatment. Over doubling, if you think about that, a doubling of the number of individuals who need care and service. So to those of us in the room, I am eager to stand arm in arm with all of you, but most importantly with our community. And as we work through the Behavioral Health Consortium, the Prescription Action, the Action Addiction Committee that we formulated, we have to be arm in arm, and we're going to have to tackle this together and to look at long-term and short-term solutions. I'm very pleased with the number of recommendations that you have provided that provide us a solid area to start the focus around opioid and heroin epidemic that we're facing. But again, as I state to the press, each of those statistics are a Greg, are a Tyler, are a Matt, who are among parents who are standing here with us. And we don't want to forget that. And that is the urgency. And that's why, as the Attorney General stated, we stand here unified and together. So I know on behalf of Governor Carney's office, the administration, and all of the other members of the General Assembly who were not able to be here, we are eager to work. And we will take all of the village and members in the community, and we want individuals to use those resources so that we can address that, so that in 10 years, we're not facing an opioid epidemic for our public health crisis. So with that, I want to thank you again for hosting this today and launching. And we welcome all of you from the media to certainly find out a little more about his initiatives with the recommendations and also the Behavioral Health Consortium, which will hopefully be a long-term solution. So thank you. Back to our MC, right? Thanks.
I want to introduce Secretary Walker, and she is still, I guess, relatively new in her job, but it has been incredibly valuable to us to have her on the job. One of her main focuses from day one has been on the quality of medical care that is involved in substance abuse treatment. And as I mentioned, the numbers, 6,000 people receiving treatment, doesn't really fully state the problem, because treatment is still not what it could be. And we are very grateful for her focus on not just providing numbers in treatment, but also providing quality treatment. So we thank you very much for your involvement, and turn things over to you.
Thank you so much for the opportunity to be here. We want to express our gratitude to the Department of Justice. Thank you so much for the interest and work on this important issue. Addiction is the public health crisis of our generation, and we know it's taken far too many lives, impacted far too many families here in Delaware and across our country. And with any public health crisis, we need all the hands on deck that we can possibly find. Everyone has to be at the table. The Department of Health and Social Services touches addiction in multiple divisions. We are working in as many places with as many leadership opportunities as possible. Our Division of Public Health has been hard at work taking a lead on this comprehensive approach to address the opioid crisis and working with partners with the Prescription Drug Action Committee, now the Addiction Action Committee. The division and the Addiction Action Committee have been focusing on safer opioid prescribing and has formed a work group on non-opioid approaches to pain management. The Division of Public Health has been working on addiction prevention education in schools. And in the general public, increasing knowledge and the ability to safely take back prescriptions when they are no longer needed. Our Division of Public Health, along with our Division of Substance Abuse and Mental Health, has also been leading the state's efforts to increase access to naloxone because we need it in the hands of first responders and community members. We need to increase the awareness of the dangers of substance abuse while pregnant, working in the office, at restaurants, and we were working with Help Us Here website and campaign to increase prevention, recognition, and the treatment of addiction. The Division of Substance Abuse and Mental Health has been working to increase access to treatment. We know we need more. We need more in as many places as we can get. And we have to base it on the scientific evidence of what treatment approaches are the most effective and data-driven. This is about preventing overdose. This is about getting people into treatment that works. This is also an emphasis on increasing access to medication-assisted therapies, or we shorten it MAT, but also recovery housing, wraparound services, and we need to make sure they're necessary and in place to support the whole person and the family when they're ready for treatment and recovery. We also need to make sure that it's ready to help people who are incarcerated or re-entering into their communities. Our Division of Substance Abuse and Mental Health is constantly assessing the system to better understand where the gaps are in treatment system and how to meet the needs of individuals. And we've added treatment capacity, but we have a lot more to do. And to get to that gap that we identified, that more people need access, we also need more providers who are willing and able to provide that therapy. The Division of Substance Abuse and Mental Health is working with clinical partners, advocacy groups, federal and state partners to complete a full review of all of the treatment regulations in place in the state to ensure they will result in the best possible outcomes for Delawareans. This is about saving lives and about helping people where they're at. And we need to decrease the barriers, and we also need to leverage all of the evidence that is out there today. As part of a national workforce facilitated by the National Council of Behavioral Health, the Division of Substance Abuse and Mental Health, and the Division of Medicaid and Medical Assistance, we're working to reduce the barriers to prescribing buprenorphine. Currently, there are more than 2,000 Medicaid enrollees utilizing this approach to treatment. We need more PCPs, primary care doctors like me, prescribing this in their offices, providing that wraparound care with counselors who are in the office, providing a true behavioral health medical home. Our Division of Medicaid and Medicaid Managed Care Organizations actually eliminated prior authorization requirements for medication-assisted therapies in July of this year to decrease those barriers. We have to do more, and this is about reducing overdose. This is about getting people into therapy when they're ready. We have more plans underway to address the serious combination of opioid and benzodiazepine use, and we recommend that we need to do that through provider education. Doctors are doing things because they've always done them the same way. We need to work with them to get better systems and data into their hands so that they know when their patient may be at risk. There is more to do. Right now, our treatment system too often treats a problem, but not the person. And DHSS is working hard to evolve the treatment system so it's comprehensive, coordinated, high quality, and person-centered. We need to not focus on the where this happens, but what happens, how we provide that care. It's not about buildings, but how we make sure that people are safe to leave those spaces and can live in the world and work and be productive members. One in which these individuals are engaged into treatment or sometimes forgiving and back into treatment at opportune times. One where there's a warm handoff, a person-to-person conversation to treatment from an overdose or identification of a substance abuse disorder, and no wrong way to enter into treatment. We've been working hard this summer, and I'm pleased to extend an invitation to the Department of Justice or anyone who wants to come to the table as we work to build centers of excellence in our state that include comprehensive evaluation, including trauma assessment, access to medication-assisted treatment, group and individual counseling, access to peer coaches, case management, and provision of links to primary care and mental health services so that addiction isn't treated in isolation to everything else, but you can take into account the entire health picture. We also need to provide links to recovery and transitional housing depending on where people are, and vocational therapy and more. Those social services, those social determinants are most important. We have to evolve in how our SUD treatment system is managed by expanding access to it, making sure that the capacity is there. We are not going to recruit more psychiatrists to our state to provide that mental health treatment separate from the rest of the person. How do we create a system that's person-centered, comprehensive, coordinated? It must evolve by making sure that we are also paying for services that are evidence-based and set expectations at the state level that allow our treatment partners, the people who are actually treating people, to manage their individual cases with those expectations in place. Through this mechanism, the state can monitor outcomes and pay for them, pay for a better quality. The recently formed Addiction Action Committee, a group that grew out of the Prescription Drug Action Committee, will continue good work with prescribers. The Department of State and Medical Society of Delaware will expand information on safe prescribing practices, including addressing a key point made in these recommendations about the concerns of co-prescribing. We have to work with the providers. Funding by the Center for Disease Control, the Division of Public Health will also provide new support and training for prescribers this fall on how to use the very latest opioid prescribing guidelines, treat for chronic pain, reduce the risk of overdose and addiction, and use medical education webinars and materials and tools, which are also on our Help Us Here website. These efforts will be coupled with the new Department of State prescription drug regulations adopted earlier this year and revised to be launched in November. I am encouraged today we're highlighting the importance of naloxone. That's critical. We have to lead efforts to increase access by first responders, school nurses, and community members. And funding to naloxone has been from various places and not as well coordinated as it could be. We're working to implement a sustainable source of funding for naloxone, including seeking federal funding and exploring insurance reimbursement. DCAM, our Division of Substance Abuse and Mental Health, will continue to provide funding for community-based training programs currently offered by Brandywine Counseling and the Division of Public Health to make sure the very latest training materials and information is available from the Help Us Here website. And Governor Carney signed legislation in July which cleared up the legal barriers to naloxone being available over the counter in participating pharmacies. Please visit www.helpushere.de.com. On evaluating involuntary treatment for those who decline treatment, we do have to proceed with care and caution, as Matt suggested. We have commissioned a report on these options, best practices from other states, and an examination of Delaware law compared to other successful states in this area. We have to learn from other states who are doing this, craft a careful policy based on successes, tailor it for Delaware, and make sure it's meeting the needs of anyone who may be clinically declared a danger to themselves or others. I also applaud the idea of seeking insurance reimbursement for alternatives to pain treatments. A work group of the Addiction Action Committee, chaired by Dr. John Goodall, is working on just this issue and will be recommending science-based approaches to managing pain by the end of this year. Thank you again to Attorney General Den for the invitation to participate today. We are so excited to have a better understanding of the treatment options that are here in the state, but know we need to do more. None of us can address this complex and deeply challenging issue alone. I look forward to the continuing partnerships to evolve the treatment system in Delaware. Thank you.
Before I ask Senator Hansen and Representative Bentz to say a few words, I wanted to invite Don Keister from Attack Addiction to come up. He is here with his wife, Jean. And Attack Addiction, I don't think I need to tout what it has done. It has been transformational in terms of what the state has done on the issue of addiction generally and naloxone specifically. We would not be where we are in terms of law enforcement agencies carrying the drug in terms of its widespread availability without the effort of the Keisters and other advocates. So we're just very grateful for the work that you have done. And although he did not want to speak to that, I wanted to recognize Chief Bryson and Jeff Horvath, who are here from the Delaware Police Chiefs Council. It's the fact that we are talking now about institutionalizing funding and not whether or not police agencies would carry this medication is in itself a huge shift. A few years ago, the issue was whether the agencies would be willing to carry the drug, period, because it was a new thing. And between the advocacy of attack addiction and the willingness of the Chiefs Council to encourage local agencies to carry the medication, it's now a widespread practice. And it's actually the fact that we are now dealing with the funding challenge is a significant step forward from where we were before. So appreciate the Chiefs Council's effort and very much appreciate everything that Don has done and his presence here today.
Thank you. You know, sometimes they say that there's all kinds of red tape and bureaucracy, things that don't get done. I can tell you about 2 years ago, I was sitting in my place watching an Eagles game, and I got a phone call from Matt Denn. He said, I have a report I want to put out. I'd like you to look at it, and I'd like you to let me know what you think about it. I also told him I was willing to let him know the Eagles score, but he said, no, it's being taped. Anyway, he took that information, the things that he did, and made laws happen this past year. We have had so many laws passed because of your initiative and what you have done, and also because of the legislators we talked to, Lieutenant Governor Bethany Hall-Long, and other advocates that have really moved the state forward. And trust me, we do have a great deal of work to do. I quote the statistic that overdose is the largest cause of death in this country for people under 50 years old. I compare it to the kind of treatment that cancer gets, and it's not there yet. But thankfully, we have a state that is interested in carrying on and doing things to help this epidemic, which is absolutely terrible. Now, I lost my son in 2012 to an overdose, and when that happens, you say to yourself, what can I do to try to help others to make this issue go away? And believe me, sometimes I feel like I'm walking in mud, but we are making strides, and I really need to thank the state for that and what is happening. I want to say one thing about, from this agenda moving forward, one thing that has really caught my eye is the development of a recovery high school for Delaware. I'm not a doctor, I'm not a lawyer, I'm just a dad who hasn't had a whole lot of experience, but I am an educator. And I can tell you that that is something that's needed here in this state, not only for kids that are going into high school and need that, but for adolescents in general. We really don't have the kind of services for adolescents that we should have and need to have. I want to just say one thing. I have spoken with the superintendent of Red Clay, with some other people. He has offered a facility, a curriculum, and additional services, and I put together a business plan and I mailed it to him today. We are going to work within the state to try to gain support. It's not going to cost us that much money. We can get this thing off the ground, I think, very easily, and the goal is for January of this year that we have a recovery high school in Newcastle County and even able to help others in the state. Will it happen? I hope so, and I really appreciate all the work that you have done for attack addiction and others that are suffering from this disease in the state. And thank you, Matt.
There are other folks who have been incredibly active in terms of helping us to get some of these bills passed, who I wanted to recognize by name: Mary Beth Chahaki, Diane Jones, Jerome Herlihy, who is a retired judge, used to be the judge on our drug court in Newcastle County, and Pat Michael, who is standing up against the door. They have also just been tireless in terms of helping us make the progress that we have made. And Dave Mangler, who I mentioned earlier from the Office of Controlled Substances, has quietly been an enormous asset in terms of helping us move forward on some of these issues, and we appreciate his work as well. I wanted to turn things over to Senator Hansen, who is still our newest senator for now, and has jumped right into this issue and has been a real leader, and we appreciate her being here today. Senator Hansen.
Thank you. I'd like to thank Attorney General Denn for his leadership in commissioning this study and putting forth solutions in what has become one of the biggest issues facing our state. Addiction to opiates and other substances is at such a crisis level because we have failures and gaps at every stage in the life cycle of recovery from an addiction. Although we have beacons of hope, like the Lyman House and others, and we have people in our system who are compassionate and committed to helping those in recovery make it through the process, our system is plagued with gaps and inconsistencies that can, and often do, sabotage the journey to recovery. I have spent many, many hours with recovering addicts and their families, with treatment providers, with counselors, with attorneys, and members of our judiciary, delving deep into the issues of what works and what does not work in the process of recovery. And I'm also actively monitoring a young man through this process and witnessing firsthand how our system is set up and how it responds to the needs of this vulnerable populations. Sometimes you just have to live it to get it. It often begins with the unnecessary overprescription of opiates in the doctor's office as the frontline treatment for pain or just anticipated pain. And when the patient becomes the addict, navigating the maze of treatment options is a Herculean task. It's daunting for someone who is not impaired, and it's nearly impossible for someone who is, or someone who is only now, for the first time in years, sober or clear-headed enough to make a rational decision. For someone lucky enough to have a person who cares about them and who can get them into an inpatient detox facility, they've navigated the first step. But discharge to the street after a week or less in treatment with no plan for the next stage in the treatment continuum is a recipe for failure. It nearly guarantees a revolving door, and this happens a lot. Treatment at an inpatient detox facility is only the first step. Most folks in recovery need continuing treatment at an outpatient facility with a program that involves intense counseling and some method of accountability. Some, those that have been struggling with addiction for years, and some for other reasons, will then need to progress to traditional, transitional, or sober living housing. Assuming that all of those treatment options are ready and available, which we cannot assume, and which we must also address going forward, we need treatment navigators assigned to each person that is admitted into our treatment facilities that can assist in getting the person in recovery to and through the next phases of the recovery process. This means more than just coordinating the journey from inpatient to outpatient to traditional, transitional, or sober living housing. Most of the time, folks in recovery don't just have one problem: addiction. The addiction has usually spawned other problems related to insurance, the loss of driving privileges, family trauma, joblessness, homelessness, and the involvement of our criminal justice system. We need treatment navigators that work as teams to provide guidance on these issues in the life of the recovering addict, because the failure to address any one of these other related and important issues to addiction can, and often does, lead the person off track and back down the path of hopelessness and renewed addiction. So granularly, what am I talking about? We need navigators that can help them fill out forms for insurance coverage, for job applications. We need navigators to untangle problems like when appointments for Medicaid coverage are scheduled at the same time as another hearing, or when a person is in inpatient treatment. We need navigators that the family members can call when important documents are received in the mail and the person is in recovery in a treatment facility or incarcerated, so they can't receive or respond to mail. Deadlines come and go. They miss important things because they're just not available, and the family members don't know who to turn to. And we need a criminal justice system that recognizes when incarceration is appropriate and when instead it works at cross purposes to our broader societal goal of reducing addiction and, by extension, preventing crime. I'm very encouraged by our new leadership in the governor's office, by our Lieutenant Governor Bethany Hall-Long's Behavioral Health Consortium, and I look forward to continuing to work with our Attorney General Matt Denn and our Secretary Walker and my colleagues in the General Assembly to delve deeply into the issues affecting our recovery community, to substantially change the way we've been addressing recovery here in the state. We all have to be on board, and we all have to be rowing in the same direction, because we have a long journey ahead.
Thank you, Senator Hansen. And I wanted to turn things over to Representative Bentz. He is the chair of the House Health Committee, and as such has pretty much shepherded every important piece of legislation involved in dealing with this crisis over the last year through the General Assembly. So we are very grateful for his efforts in that front and welcome you here today.
Good afternoon, everybody. I want to start by just, again, acknowledging, I think, a lot of the work that has been done up to this point. Several of the speakers who came before me have highlighted, I think, a number of great efforts that we've put forward so far. But I think what this report that was commissioned by the Attorney General's office indicates, and what really the mounting loss of life indicates, is that there's still a long way to go. And the list of recommendations proposed by the Attorney General, I think, are substantive. I think they would make a very important impact on moving us in the right direction and where we're trying to go, to stem the loss of life, to provide treatment to those who need it, to get their lives back on track. A number of them will be difficult, as is the case with substantive reform. They will have costs associated with them. They will take interagency and across industry cooperation to achieve them. So there will be all hands on deck sorts of policies. But I remain optimistic that we're going to be successful, because I look over at the advocates from the community, from various state agencies, the Department of Health, the Attorney General's office, and the legislature. There's a real desire, a real determination to get this right and to start this state on the right track. It's going to take a long time. It will take years to address these problems and to really cut off the flow of drugs to the street, and then connecting people to the treatment that they need to get themselves clean. But like I said, I remain optimistic that we're heading in the right direction, and that everybody is rowing in the same direction, so to speak, to borrow Senator Hansen's term, and we're going to get there. So thank you.
Last person I want to introduce is Dr. Carol Rattay, who is the state's director of the Division of Public Health. I saved the cleanup spot for her for a couple of reasons, one of which is that she is very good at tying things together, and secondly, I get my flu shot every year in a public place as part of the state's promotion of getting flu inoculations, and about every other year, Dr. Rattay actually administers my flu shot. So given that we are entering flu season, I need to be particularly nice to her for the next 60 days or so. So I'll turn things over to you, Dr. Rattay.
That is right. Flu season is almost upon us. Thank you, Attorney General, for your leadership and commitment to helping us address this crisis. I also want to give a shout out of gratitude to our Governor Carney, our Lieutenant Governor Bethany Hall Long, for her leadership with the new Behavioral Health Consortium, and to Dr. Walker, her commitment to addressing this issue as well. Many state agencies are involved in addressing this issue, and without the partners that we are working with in the community, we could never get the work done that we have been doing. But as you all have heard, we know that there is a lot more still to accomplish. When most people hear me talk, you hear me talk about the comprehensive approach, which is absolutely critical. It's critical that we focus on the prevention side of things. So improved prescribing, we must continue to work with the Department of State as well as the Addiction Action Committee to make further strides forward in safe prescribing, but also increasing access to non-opioid approaches to pain management. So as was mentioned, we do have a working group as part of the Addiction Action Committee that is working on this issue to identify scientific approaches to pain management that should be better covered by insurance. We're also working, and I want to give a shout out to Becky King, who's our Public Health Nursing Director, and she's helping us lead efforts in schools. We know it's very important that children are receiving evidence-based substance abuse prevention programming in schools. And additionally, the public needs to be aware of how best to manage pain, what to do with those drugs in your medicine cabinet, and also what's available for treatment. And that's why helpusherede.com is our go-to website here in the state that we continue to grow all of the time. In fact, in just a few weeks, we're going to have additional tools to help support provider practice change on that website. But really, treatment is the focus today. The report that the Attorney General commissioned really focused in on our treatment system. And we know that too many people are not finding their way to treatment when they're ready for it. And we know that too many people are not receiving the best scientifically based treatment, such as medication-assisted treatment. And we also know, as Senator Hansen mentioned, many people are slipping through the cracks when they need to transition from one level of treatment to another. And so, as Dr. Walker mentioned, we are creating centers of excellence in the state. These are going to be comprehensive, coordinated, integrated, and very importantly, person-centered approaches to treatment. And you've already heard about this to some degree. We're looking forward to sharing more in the future and really getting your feedback. In fact, on October 26th, we have a forum that's coming. Our Attorney General is going to be joining us, where we're going to be talking more about this vision, as well as bringing in some best practices from other states and really having discussion about what's possible in Delaware. So we hope that you will join us and provide us your feedback. Want to emphasize one more piece of this, which was alluded to, but from our perspective, we know one of the areas where we need to focus the hardest is engaging people into treatment or back into treatment if they have fallen out of treatment. And some of our areas of greatest focus include an EMS, an emergency department system of care, similar to the trauma system. So this is going to be an important part of our efforts over the next year. It's also really important that we partner with the criminal justice system. Many individuals with SUD are affiliated with the criminal justice system, and we want to strengthen those connections. And also, very importantly, we want to reach women who are pregnant and get them engaged into treatment as soon as possible. Again, I thank everyone for your efforts, and we look forward to continuing to partner as we tackle this crisis together.
Thank you, Dr. Rattay. I encourage you, if you haven't had a chance to speak to some of the other advocates who we just didn't have time to have come up today, to do so after we're done. They all have incredible stories to tell, and we just value very much their insight. And I apologize for not seeing Becky King standing against the wall. And I should have mentioned her along with everyone else. She has also been a critical part of this effort. I just wanted to finish up by mentioning a few other individuals, specifically from this office. Lucretia Roberts, who's the Chief Deputy Attorney General, who was here and had to step out. She really was responsible for our office in making this independent report possible, and she is going to be quarterbacking all the efforts that are laid out in the series of recommendations that we handed out today, on top of being the second person in charge of the department, which is a full-time job plus in and of itself. Christian Wright, who is in the back, is the head of our fraud unit and also a busy guy in that regard. He is heading up the efforts to implement the legislation that was passed last year to provide legal assistance and medical assistance to people who are cut off or otherwise denied treatment. And he's also heading up our efforts to retain private legal counsel to investigate, and if the facts warrant it, take legal action against manufacturers of prescription opioids for their marketing practices. So he has also taken on all that in addition to all of his other responsibilities, and we are very grateful for that. And finally, Julia Laws, who I saw in the back of the room, in addition to all of her considerable job responsibilities. If you call the Department of Justice and you are unhappy about something, you eventually find your way to Julie. And we have a fair number of people who meet that description. So she is, that again is a full-time job in and of itself. But when last year we were trying to set up the nation's first statewide opioid overdose death review commission, and it needed to be staffed, and we needed someone from within the department to do that because there weren't state funds to add a new person, Julie stepped forward and volunteered to do the work on top of everything else that she has to do, and she's doing a great job with it. So we are very grateful for her work as well. Thank you for being here today, everyone, and I think all of us will be here afterwards if you want to talk to any of us individually. Thank you.